Thank you all for attending, and I'm delighted to see there's so much interest in pain. It's obviously something that I've been dealing with and working with for over 30 years now. As he said, we've been around since 1980. We are a nonprofit tax-exempt organization, and we have peer-led support groups throughout the country and around the world. And those groups, while we're not healthcare providers and we don't provide any kind of medical treatment or advice, we work in addition to healthcare providers. What we do offer is a sense of hope, to let people know that they're not alone. They're not the only one out there with pain. Pain is very isolating. The worse the pain gets, the more you pull away and isolate from others. And I'm going to, sort of like an echo in this room, that I'm going to say a few of the things that he said before. But chronic pain, persistent pain, is any pain that lasts longer than 3 months. And it can interfere with our quality of life. But that last highlight thing, that it's not consistent. And I think that is the most confusing thing for people with pain and everyone around them. We have good days and bad days. And so some days we're able to function, other days we're not. And when you see somebody with pain and you see them doing something one day, and then the next day they're down and out, you wonder what's going on here. And then a few days later they're up. That's because it is up and down. It's inconsistent, and that is so confusing for everyone. And as I said, echoing in the room, it's the #1 cause of disability in the United States today, and there are more than 100 million people with some form of chronic persistent pain. That's 1 out of every 3 people. It costs more than $600 billion a year, and as he said, that's more than heart disease, cancer, and diabetes combined. It is a major health care problem. And one of the things over the many years that I've been doing this is I often wonder why we're not hearing more positive things about pain and people with pain and the accomplishments that they can actually do. You can live with pain, as I will say. Persistent pain is a process that turns the sufferer from a person into a patient. With increased research, the right health care, the coping skills, and support, our hope is to change that patient back into a person again. And that's really the key. Obviously, everything I say is about from patient to person. I have a real issue with being called a chronic pain patient. I'm a person with pain. These are the faces of people with pain. Look at them. They're just like you and me. Everybody, anybody, it can be anyone. It doesn't matter. I'm the face of the person with pain. This is what we look like. We're just everyday people. You have no idea. Walking down the street, if you're looking, you may be sitting next to someone. And the key is because pain's invisible. You can't see it. You can't measure it. There's no way to weigh it, smell it, taste it. You can't. It's a matter of believing someone that has pain. It's completely invisible, and as I said, when your functioning is up and down one day to the next, it's really hard to understand, especially for those around you. And we look to medicine to fix us. After all, they can give us new hearts, new lungs, new livers. Why can't they take away our pain? That doesn't make sense. And yet, we believe that there's that one thing out there that's going to fix us, that one magical pill. That's all we need, right? But that's not the way it is. And so we get stuck in this maze, and we go from one dead end to another over and over and over again, day after day. And the whole time we're doing this, our families are drugged right along with us, and their emotions are just as effective. The thing about pain, and people say, it's the pain is controlling my life. It's quite often, it's not the pain. When the pain's there, we know it. It's the fear of the pain, never knowing when it's going to hit. When is the next time that we're not going to be able to fulfill our role? And so what happens? We begin to pull away. That's where the isolation comes from. We do less and less because we never know. The fear is the controlling factor in our pain. And the longer our pain goes on, the more we lose who we are. It's like these 2 men walking down the road into the fog. They disappear. And that's when people become and call themselves chronic pain patients. That is their whole identity, and their whole world is focused around their pain. We look to our healthcare providers to help us. The problem is they've never been trained. On an average, they may get 2 hours, if they're lucky, of pain management, and most of that's on prescribing. And so we look to them, and they say, you're going to have to learn to live with it. And it makes us want to scream. That's how it feels. And it looks like this. This is, I don't know what it is. It's some kind of formula. And if you asked me to solve it, I would be here the rest of my life, and for all I know, it could be solved. And so when you tell someone to learn to live with pain, it looks like it's impossible. It is impossible. So what I have been trying to do with the American Chronic Pain Association to help people learn to live with pain is to make that very complex, how am I going to do it, into some simple way that people can actually begin to understand how to live with pain. And so over the years, we have changed that complex formula into 1 + 1 = 2. We do that through all of our graphical communication tools, through taking coping skills and teaching them. They're all on our website. You can look at them. So first of all, before anyone can really make that beginning of moving from patient to person, they need to have their pain validated. We need to be validated to someone to believe us. We become so defensive. Everyone's asking us, are you sure you have pain? You look good, right? When was the last time you went to a doctor in your pajamas? You look good. You look good when you're at the doctor's. We make a huge effort to do that. We need validation. We need you to believe us. Take away the defenses and we'll begin to work. We need to know that there's a hope for a better tomorrow. And through research and support, that hope can happen. We need hope, and that's one of the things that the American Chronic Pain Association has done. But there's another piece of this, a piece that we very rarely hear about, and that is the person with pain has got to take an active role in the recovery process. We can't be that passive patient and look for health care to fix us. We've got to take an active role and become an active participant in our health care. And through the goal of living with pain is to reduce your sense of suffering, to improve the quality of your life, and to increase your function. Nowhere in this goal does it say take away your pain completely. Even when you have done absolutely everything, worked with your healthcare provider, done all that you need to do, there still may be some level of pain. But you can live a full life in spite of pain. 34 years ago, I went into a pain management program as a person, as a patient, and holding a cup of coffee was almost impossible for me to do. After 7 very long, painful weeks, I came out, in every sense of the word, a person again. And you can live with pain. They didn't take away your pain, they teach you how to live with it. They changed that very complex formula into something that I could actually live with. These are our 10 steps from patient to person. It's not a 10-step program. The first 2 I think people have to do, accepting the pain and then getting involved. The rest of them depends on what their needs are. And if I had more time, I would talk about them. So through more research is needed to unlock all the mysteries of pain. There is so much more that we need to know. We're only scratching the surface. And I know that the 2 ladies after me are going to talk more about that. So thank you very much. And there's our website if you want to look at it. We've got lots of information on it.